We're with Amalia Adler-Waxman, Vice President for ESG at Teva. Hi, Amalia.
Hi, Momo.
Teva recently published 2030 sustainability goals based on a comprehensive ESG strategy that was launched towards the end of 2020. Could you sort of give us an overview of what we could find there?
So in the middle of 2020, Teva senior management approved a renewed ESG strategy, making ESG really integral to the business of Teva. And the strategy followed a very thorough materiality assessment that we've conducted last year, where we identified approximately 21 topics, out of which we singled about 8 top priorities, which are critically important for us to focus on in the coming years. We will report and focus on all of them, but there are a few that are really the top priorities for Teva. So under environment, we're talking about emissions, waste, water, and antimicrobial resistance. Under social, we're talking about access to medicines, especially generics, inclusion and diversity, and employee engagement. And under governance, we're talking about ethics as well as ESG in the supply chain.
And so let's start with the E, since you've mentioned it already. What could we find there? I imagine that those are science-based targets, as we hear from quite a lot of companies nowadays. What would you highlight for the environment in terms of the issues that you've mentioned?
So in the environmental area, we've made significant progress in the last few years, and we achieved and even surpassed some of our ambitious targets already. So our new targets, and I'll give an example, for instance, in Europe, 60% of our energy is coming from renewable energy. Moving forward, we developed our 2030 goals, and we are going to align ourselves with the Paris Agreement, focusing on reducing by 33% our greenhouse gas emissions, Scope 1 and Scope 2. We're talking about reducing our waste and also reducing water by 10%, especially in water scarce regions such as Israel or India.
So that's definitely gives us an overview. Are you following a strategy of setting the goals and then, putting everyone into finding the ways to meet them, or are you already have an action plan for each one of them?
So clearly we will not publish goals if we don't know how we're going to achieve them. And this is why for some of the other topics that I mentioned before, we are in the process of developing targets and KPIs, key performance indicators. The objective is that we will publish those in the coming year, in 2021, because we want to make sure that when we announce targets, they're right for Teva, they reflect where Teva is and what Teva can achieve, and also that there is a plan and we know how we're going to go about it.
Good. So we'll probably follow and see what are the new goals in that regard. Let's move to the S, and you've mentioned access to health. This is definitely one of the most major issues for pharmaceutical companies. What could we find there in terms of access to health?
So access to medicines is our really top priority, which is on the intersection between our social impact and who we are as a business. Teva is one of the largest generic companies globally. We have the most broad generics portfolio, which means that we have very large coverage for products on WHO essential list of medicine. And this means that we want to make sure that people who may not have access to our medicines through our normal commercial processes or operations will be able to reach, if there is a specific and identified unmet need, our medicines. So the way we're committing to access is in 2 ways. First of all, it's who we are. When medicines become generics,
they're much more affordable.
They're more affordable and therefore more accessible. But also we are committing under this new strategy to 8 programs to launch 8 programs in the coming years, where we intend in partnership to identify vulnerable populations in multiple regions in the world, both in countries where we operate, as well as in low middle income countries, for instance, in sub-Saharan Africa. And we intend to identify partners and see how we can offer our medicines through different approaches that we are currently examining. There is a whole spectrum between donation and social business, and we're in the process of building this program.
And could you, I mean, I would imagine that part of those programs and partnerships is also tackle that part of the chain where you might have the medicine, but people aren't necessarily have the access to treatment. So could you give us an example of such a sort of a cooperation in progress?
Right. So it's great that you're asking, because we're actually not starting from nothing. We launched last year a small pilot with partners in North America. It's Texas Kids and Direct Relief, two organizations. One is a hospital and one is a charitable organization. Both of them are very experienced in working in Africa. So what we've learned is that children with cancer can survive. Approximately 80% of children with cancer in developed countries survive. Unfortunately, in Africa, 90% of children die. So the program that Texas Kids established in select countries in Africa is to improve survival rates of children, pediatric cancer. So they reached out to us, and we were able to provide of about 27 medicines that they asked for 20 medicines, which is quite incredible. And but they have set up a program that is really 360 program. They build capacity, they train doctors, they train nurses, they improve diagnostic, they get to the children at the earlier stages to ensure that the cancer has not developed children did not come to the clinic too late. They build clinics, and they also needed medicines. So we are partnering with them, and moving forward, they plan to scale the program into more sites. We started with a pilot in Malawi. Our medicines reached a few months ago, and we are planning to scale the program with Texas Kids in the coming year.
It sounds very helpful. With the G, what would you emphasize there? You've mentioned ethics as one of the priorities.
So we are continuing to commit to make sure that our employees behave ethically, and that compliance and ethics is at the heart of the culture of Teva and the operations of Teva. We're measuring it through the number of employees that we're training, continuous updates of our policies, of our codes, and so on. And the other issue, which is a really top priority for us, is to set up targets for ESG in the supply chain. So in order to meet, for instance, some of our environmental targets, our ethic targets, we need to make sure that we apply some criteria and some audits and training to our suppliers. And this is a major project that we're going to undertake in the coming year.
Again, immensely important for a huge global corporation like Teva. And obviously, again, the ethics issue, which is high on the agenda. And I think a lot of actions have been taken in the past couple of years to deal with the issues that were there. Let's wrap up with COVID. You can't conduct a conversation today, unfortunately, without COVID. ESG, COVID, Teva, what would be your summary of sort of the events of the past year?
Yeah. I think that we all recognize how important pharmaceutical companies were and will continue to be during pandemics and in this COVID-19 very difficult pandemic. So our focus was predominantly on ensuring that our employees are protected, that they are healthy, and that they're able to continue and manufacture our medicines consistently, and to ensure that our supply is as little interrupted as was possible during this very difficult year. And our facilities and our manufacturing sites remained open, and we were able to and provide our medicines to the 200 million patients that need them every day. We were able to help hospitals with medicines that became extremely needed during COVID-19. And we also supported governments in the early time of COVID-19 this year with donation of products that were needed to initially for experimental purposes. We also took very seriously the well-being of our employees and their families. We ensured that employees can work from home and that they are supported, including their families to the extent possible. And we really made sure that we don't lay off people and we keep our employees, safe and just continuing.
That's good to know. And in terms, by the way, of the dialogue with stakeholders, with ESG investors, have you seen any change during 2020?
So we see more and more interest of investors to engage with us, and I believe with other companies, but we clearly recognize that they engage more and more with us on ESG issues. Directly. Their ESG analysts are present in conversations, and they're very proactive in learning and hearing from companies on where ESG is in the strategy, and also the very specifics of what we are doing in the area of ESG.
Yeah, and that's definitely sort of fits very well with the figures that we see and the rise of ESG investment, and I think the rise of the discussion around ESG
clearly.
During the COVID time.
I think we all see, Larry Fink and many others, issuing statements and CEO letters for a few years, but I think COVID-19 was the ESG year.
Yeah, in that regard, it definitely boosted
in many ways.
ESG.
It elevated the role companies play on society, their responsibility, and I think also their importance.
Yeah, I absolutely agree. Good. So probably we could read a lot more about ESG, Teva's ESG strategy and goals on your website, and we'll follow up and see what's coming up during 2021. Amalia, thank you very much.
Thank you very much for having me.